Hi, my name is Catherine Woods and I'm Chair of Physical Activity for Health in the University of Limerick. I'm located within the Health Research Institute and the cluster on physical activity for health. This is based in the Department of Physical Education and Sports Sciences. The area that I cover is physical activity for health. Physical activity involves any bodily movement which involves skeletal muscles and increases energy expenditure. If done at the correct intensity and for the correct amount, you can have significant health benefits. For example, a reduction in cardiovascular disease, a reduction in the likelihood of getting type 2 diabetes, and also a range of mental health, physical health, and social health benefits. So physical activity is what we call public health's best buy in terms of promoting health and well-being for the population. However, in Ireland at present, the prevalence of physical inactivity, that is where our population are doing insufficient amounts of physical activity to benefit their health, is very prevalent. For example, in adults, 1 in 3 adults are insufficiently active for health. In older adults, 1 in 4 adults are insufficiently active for health. And in children, in actual fact, it's 1 in 5 children who fail to meet the minimum requirements of physical activity to protect their current health and prevent future health problems. In order to change levels of physical activity, there are a number of areas that we focus on. These include measurement, trying to understand how active or inactive people are, determinants or the factors that influence why people participate in physical activity or why they avoid physical activity, and also the design of interventions that use theory to inform practice in order to enhance the likelihood of these interventions making a real change in population levels of physical activity. So let me give you some examples. Very recently, we conducted the Children's Sports Participation for Physical Activity. This was funded by Sport Ireland and Healthy Ireland, and over a 12-month period, we visited over 100 schools across the Republic of Ireland and Northern Ireland. In these schools, we met over 6,000 children, and each child completed either a detailed questionnaire on physical activity for health or took part in physical activity assessments, including a 20-metre shuttle run test, measures of strength, measures of flexibility, height and weight. We also asked some of the children to wear a device that measured how much they stood, how much they sat, how much they moved around and how much they slept. And looking at this data, we were able to see how active or inactive the children of Ireland actually are, what they prefer to do and what they would like to do. And this is important because it informs us if we have a problem with physical activity. So right now, we know that roughly about 1 in 5 children are meeting the physical activity guidelines that are important for them to meet the health benefits for their age. This is not really where we'd like it to be. We would like our children to be much more active. So what we have to do now is to design interventions. So again, we go back to this data and we look at the answers the children give us in relation to what they do in physical education, what they would like to do in physical education, what they take part in after school or in community-based sports, and whether they walk or cycle to school. We also look at how much time they spend sitting. And then from this, a team of scientists made up of exercise scientists, made up of psychologists, made up of physical activity coaches, made up of physical education teachers, we sit down and we design interventions to try and increase physical activity among this population cohort. So at the moment, we're working with the Department of Education to look at something called the active school flag. The active school flag is very popular in primary schools, but less popular in post-primary schools. So what we are trying to do is develop an intervention that is acceptable and enjoyable to both the post-primary children, but also their teachers, their principals, their parents and the local environment in terms of encouraging those children to walk or cycle to school, to engage in physical education in a meaningful way, to engage in extracurricular and community-based sports. Other interventions that we're engaging in at the moment involve older adults. And again, looking at the data from the Irish Sports Monitor or other longitudinal studies like TILDA, we found that older adults over the age of 50 are more likely to be inactive than younger adults. And as a person ages, the level of physical activity they engage in goes down. So again, using a multidisciplinary team made up of exercise scientists, made up of medical practitioners, made up of physiotherapists, psychologists, and behaviour change specialists, we designed a physical activity intervention in collaboration with our local sports partnerships, both here in Limerick and in County Clare. And over a 7 to 8 month period, we recruited over 700 individuals who were not meeting the physical activity guidelines for that age group, and encouraged them to be physically active through programs designed for walking, cycling, general structured exercise programs, and a program designed purely for men called Men on the Move. We've tracked those individuals now over a 6 month period and are beginning to look at the results. And what we hope is that the intervention will have increased physical activity in the group who received the intervention as opposed to the control group, which received either usual care or were on a waiting list. So physical activity is very important for your health. There is a recommendation from the Department of Health in relation to how much physical activity people should do. For example, for adults, the Department of Health recommends that adults should be active at a moderate to vigorous intensity for at least 30 minutes 5 days a week. That accrues to 150 minutes of physical activity, or if you want to get involved in more intense or vigorous physical activity, at least 75 minutes per week. For children, the recommendations are higher. In actual fact, children should be active for at least 60 minutes a day. And that means 60 minutes of moderate intensity physical activity or greater. Now, those 60 minutes don't have to be done all in one bout. They can be done over the period of the day. So for example, walking to school, walking home from school, and taking part in your favourite extracurricular sport or physical activity. For example, swimming, basketball, football, whatever it is that you enjoy doing. Now, within the University of Limerick, our colleagues on the Move for Life programme include individuals from the Graduate Entry Medical School, individuals from School of Allied Health, specifically the Physiotherapy Department, individuals from the Department of Psychology, and also individuals from my own department, which is the Department of Physical Education and Sports Sciences. And we all work together to try and find solutions of how to increase physical activity in inactive older adults. So over a number of months we sat down and we first of all measured the level of physical activity in over 700 adults who opted to engage in our study. And looking at that data, we designed an intervention around several different behaviour change theories. For example, the theory of planned behaviour, but equally we looked at behaviour change principles, social support, and group cohesion and group dynamics. Combining those, we trained local sports development officers so that when they were teaching their walking programs, their cycling programs, their structured exercise programs, and the programs that they had designed specifically for men called Men on the Move, to actually build in these behaviour change principles. In addition to the sports development officers, peer assistants or peer mentors were identified, and these individuals became very important in helping the group sustain the physical activity behaviour after the formal programme finished. So we're at the evaluation stage. We've just completed the data collection and we're now looking forward to getting down to analysing the data to see what the impact of the intervention was. So that provides a summary of some of the important work we do within the Cluster for Physical Activity and Health Research, which comes under the Health Research Institute within the University of Limerick. My name is Catherine Woods. I'm Professor of Physical Activity and Health in the Department of Physical Education and Sports Sciences. Please feel free to contact me at any stage if you have any questions or are interested in this area of research.